Good afternoon, Dr. Moser. Thank you for your availability, for your openness to talk to us in this Solidarity Bridge Fiesta Week. And maybe begin the conversation by asking you to please tell us a little bit about yourself. Who were you when you joined Solidarity Bridge, and what role you serve now?
Somewhere around 2003, Kate Scott, who was a nurse practitioner and my surgical assistant, had traveled to Bolivia as part of the Solidarity Bridge mission. She finally harassed me enough that my better angel came through, and I decided that I would join the group on one of their trips. I was always very skeptical that neurosurgery was a useful or a good use of limited resources. It's too technologically involved. But I went and off to a country that I did not know much about, and a language that was foreign to me. But some very important encounters occurred there. We visited several hospitals, including the Children's Hospital of La Paz, where one became readily aware of the great limitations and the absolute dedication of the neurosurgeons there, who were trying to do their best with so little to work with. I guess when I was thinking about this whole discussion, I would probably call that my epiphany, sort of an illuminating moment, when I finally realized that their problems were actually also going to be my problems. The problems that the neurosurgeons at the La Paz Children's Hospital had didn't disappear just because I thought there was a better way to utilize limited resources. They still had to deal with all of those problems. So I think from that first encounter, the concept of the neurosurgery program emerged as a resource for education, for training, for equipping, to focus on their desire to be better at what they're doing.
Thank you. What it's beautiful to hear this and listen. The realization that a short-term trip, a one-time maybe trip, has turned into such a long-term relationship of so many years now. And I'm wondering what keeps you motivated, what drives you to remain committed to this work?
It was always much more than just about performing a few operations or helping out in a few cases. Because while it may benefit that individual person that I was helping with, it would not produce a sustainable or durable benefit. Bolivia is actually rich in one very important thing, and that is its human capital. Many of the neurosurgeons have trained in major centers elsewhere in South America and Europe. But when they return to Bolivia, they have little opportunity to develop further and few resources at their disposal. What developed over all of this time was the trust and respect that we had for one another. And it was that clearly sustained us. With the many trips that we have had, it has made it possible for us to become like brothers and sisters. We want to make the world a better place, yet one step at a time.
Yes. There is your vision and this deep partnering that you talk about with the Bolivian colleagues and Bolivian hospitals, and you've helped build this neurosurgery program into something very strong, and it's creating, and we're evolving into something new.
This would not be happening if it were just dependent on what little that I could do myself. So the fact that we've had neurosurgeons and others from numerous universities, they've all participated in courses and mentoring initiatives that we've had.
Mhm.
It's their continued interest that is the engine driving us forward.
And in that line, what have you learned from your colleagues in Bolivia?
I would tell you, it is bi-directional. I have learned. I tried to figure out what it was that I've learned. Professionally, I've learned how to do better without, to think first, and then to do what should be done and not necessarily everything that can be done. I think that wisdom is applied daily in Bolivia as neurosurgeons there try to do what is doable and continuing to not want to do harm. I feel a oneness of our profession and our purpose. And that sustains and invigorates my own work and probably best defines why I keep returning.
I don't think there's no a neurosurgeon in Bolivia who doesn't know you and who thinks of you
For
in very
better or worse.
fraternal, yeah, in very fraternal terms, and it is beautiful. I think, and I think that's the importance of the presence that you've said. You know, the importance of being there and being a reference of
Yeah,
collegiality, also of common goals.
probably simply is we all share in this one world. It helps to place our work in Bolivia in a global context and to be able to utilize that to succeed, to provide training, educational opportunities, to mobilize resources. And we are the ones who are trying to close the gap between this great global vision of universal health care and the reality that we work with on the ground. Uh, but I think that because of our work locally, we are the ones that are bringing about this commitment to achieve universal health coverage as a human right.